So the first speaker in the Active Innovation session is Clemens from SAP.
Yes, perfect. Thank you very much. So first of all, I would like to thank the organizers for having me here today. And in the next 15 minutes, I want to take you very, very quickly, because we are getting towards the end of this very exciting conference and everybody's getting tired, of course, right? I want to move you very, very quickly through a couple of things that SAP is doing in the area of health, as well as some of the things that have to do with precision medicine. And I will try to hook in to some of the points that were raised in this very interesting panel discussion that you just listened to. Now, I would first of all like to start out by introducing our company. I guess most of you, of course, know what SAP is, so let me not go into too much detail. But what is very important is, of course, that SAP is very active for many, many years already in the healthcare area. So we have many, many hospitals and healthcare providers that are our customers, and many different pharma companies, for instance, that are our customers. But what not many people know is, of course, that over the last couple of years we have made a massive investment in health as a very specific area where we would like to enter. And I think that today I can hopefully make clear to you why we think that this is a good fit. Because we are producing some technology and some solutions that we think are very, very useful if you want to look at big data in healthcare. Okay, now this is a slide without any text, but I think it shows the problem of healthcare very, very well. Because this is basically what we are all confronted with. If I visit the hospital, I'm a PhD in biology, by the way, so I have a lot of affinity for the medical industry and healthcare. If I visit a hospital, you notice that a lot of the data is still collected on paper, in Excel sheets, and in many other different formats. And this is very unusual, but because the other industries that we from SAP are dealing with, they are moving ahead with digitalization at rocket speed. Yeah, they are leaving even SAP behind. But in healthcare, we are struggling, apparently, still with digitalization. Now the question is, of course, why is that? There are significant barriers why digitalization in healthcare is not happening at such a rapid speed. The roadblocks are that it is difficult to get access to the right kind of data. The data has to be anonymized. We heard there are data privacy difficulties and challenges and so on. It is very hard to collaborate on the data. The difficulty is also that many people in the medical profession are very, very busy. They want to talk to patients and they have no interest to really work and to get to know EHR systems, for instance. There are not that many meaningful applications that a physician, for instance, or somebody in life science research can use that are very intuitive, that they like to use, right? You really have to create solutions that people love to use. The other thing that we hear is many of the solutions are black box algorithms. People do not really know what is happening behind the scenes if some analysis is taking place. And this is, of course, especially important for medical doctors because they always want to know, if I talk to a patient, what is actually happening? How can I give this patient the best advice? And as I mentioned before, we have privacy, compliance, and security issues as well. And finally, there is a lot of talk about patient engagement. And I think all of us know, for instance, the iPhone is almost a medical device. And there are thousands of apps that you can already download from iTunes, right? Patient applications. But still the patient engagement is not fully tailored yet to the patient and to the physician. Now, with that I have drawn a very, very negative picture. But in fact, the picture is not that negative. Because healthcare, and this is a statement from Eric de Pol, healthcare is actually at the moment in the Gutenberg moment. Gutenberg, of course, invented the book press, and this changed everything. And we see the same happening in healthcare at the moment. Why is that? Why can we make that statement? We heard it today from Sophia Genetics. The cost of sequencing a genome has dropped by a factor of 1 million in about 10 years. Absolutely amazing. That means every one of us can get a genome sequenced. We have more and more mobile devices that all of us are using. I have about 3 of these in the meantime. And they help us to track how we are doing. We saw a couple of good examples during this session as well. And of course there are other things happening, big data analytics. It's much easier to analyze big data. People talk about data lakes, for instance, from which you can gather insights and gather information. So a lot of things are happening that are going very, very well. And that is what I would like to talk about today in some more detail. Okay, now I would like to start a video. Maybe one of the colleagues...
Last year, about 1.7 million people in the United States were diagnosed with cancer. Each of these people had their own stories, with individual characteristics, treatment regimens, and outcomes. Information that was locked away in silos of electronic health records. What if there was a way to connect these silos and give oncologists like you access to the real-world data they store? That's the idea behind CancerLink, a powerful technology platform that harnesses big data to improve the quality of care for people with cancer. CancerLink connects and analyzes electronic records to provide data you can use to make more informed decisions. It was developed by leading oncologists with the American Society of Clinical Oncology, along with SAP, to provide access to a wealth of clinical information that, until now, was inaccessible. CancerLink generates usable, searchable, real-time information you can retrieve from your desktop, laptop, or mobile device, giving you the ability to compare actual care you are providing for your patients against guidelines, helping you give them quality care, regardless of community and setting. CancerLink can explore patterns and trends across patient characteristics that will help you coordinate and improve the care for your patients. CancerLink gives you the ability to identify the best evidence-based course of care by allowing you to compare your patient's care against data from patients like them. At every step of the cancer experience, you and your patients can contribute to and gain from the continuous learning cycle CancerLink makes possible. CancerLink makes the wisdom of the entire oncology community available to you at every patient visit. This technology is in development for use in practices today, building on the potential to deliver high-quality, evidence-based care more efficiently than ever. This will be the way we treat people living with cancer for generations to come. Be part of it. Go to cancerlink.org to learn more. Ask for a live demonstration so you can see how CancerLink can work for you and your patients.
Okay, you can stop the video. So I can assure you that CancerLink works better than this video. I hope so, because this was, of course, I don't know, technical issue. I wanted to jump right in, because what I want to talk about after I talked about the challenges and some of the opportunities is what are our customers doing? So what are already people doing at the moment with technology to improve patient outcomes? And I think that this is a very quick example. You can go to the website of CancerLink, actually look at the video and other information material there as well. Now the key thing is that CancerLink is an organization, a company that was founded by the American Society of Clinical Oncology. And ASCO has about 45,000 oncologists worldwide as members. And these oncologists said, we have a challenge, because I'm sitting somewhere in my office and I don't have a colleague that I can talk to, but I need their information to learn from them how I can actually improve my treatment of my patients. So ASCO then decided, with the help of the contributions that these members pay, to create the company CancerLink, and CancerLink, on top of the SAP HANA technology, built this exciting platform that allows oncologists to learn from one another, to communicate and collaborate with one another. Of course, this is very much a big data platform. At the moment, ASCO has uploaded from 75 hospitals, practices, 1.5 million patient records. This number is steadily growing. So this is really a system that scales magnificently. And it allows really to support the physicians in their day-to-day work. Now, another point that is very exciting, where Asko said we need help from SAP, is to look at something which we call clinical quality. If you think about a physician who is working with certain patients, let's say with lung cancer patients, and this physician is checking how is the quality of my treatment, how is that in comparison to my peers. This oncologist would like to see this information in an easy to interpret dashboard. It is not so visible maybe here, but what you can see is that for a particular clinical measure, a hit can be made about 81%. This can be, for instance, that this physician has decided to do a certain treatment with a certain therapy. And they can benchmark themselves, you can see here the little arrows there, against their peers. And this kind of dashboard is adjustable for any kind of quality measure. So you can also look at how are the payments going? How much money do we get back from the insurance? Different kinds of treatments, etc., etc. So these are the kind of dashboards that we are building out at the moment with CancerLink to support their physicians to really be able to do these kind of comparisons. Now we heard today as well, how can we get started in Bulgaria? So ASCO is a huge organization, right? It's an American organization. You can believe me, they have the money to back this up. Yeah? But how does it look in other countries? So let's go to a country that is slightly smaller. In this case, we go to Austria. And they are building up a system which is relatively similar together with us. And this is basically a system that is very much focused on biomarker research. So they again want to combine all the patient data from all the oncology clinics and other diseases as well into a system so that they can mine this information and again draw conclusions from it. And this has a slightly different view. Of course, this is also about improving treatments, but this is also about writing more publications, doing more efficient clinical trials, etc., etc. And again, we use here the same platform strategy that CancerLink is also using. So this is an example, I think, that is very well transferable to, for instance, a country like Bulgaria, and I'm very happy that we are working with our strategic partner, Skillline, here in Bulgaria, as well as with the colleagues from Novartis, on also exploring these kind of platforms to be implemented here. Okay. Now, I talk now about how we can collect or how we can combine data from many different resources. But of course, there are other solutions that you can think about as well. And one of them is around health engagement. So what we have created is also a second kind of platform that is disease agnostic, you could say. So you can use it for any kind of diagnosis. You can use this for prevention for diseases, etc. And this is a kind of application where through, for instance, a smartphone or a medical device, a patient can interact directly with their physician, with researchers, or with program directors. And this is a kind of application, it's a kind of application platform that is now being built out by our partners. So they are creating scenarios on this platform to help patients engage better with their physicians. Okay, now I would like to, coming towards the end of the presentation that I would like to give you today, I would like to come slowly to the area of how does this actually work. So what is SAP's basic strategy and what is our product portfolio that supports this? Now the basis of everything that we do is SAP HANA. SAP HANA is an in-memory database technology, although it goes far beyond that. It is a high-speed, real-time, in-memory analytics service. And this database allows you to really look at huge amounts of patients. For instance, we are looking at cohorts with more than 1 million patients, slicing and dicing these patients or these patient cohorts across 60 to 70 different characteristics that each patient has. And if you start to do that kind of analytics, of course you need something that is really, really fast. And that is what SAP HANA allows you, because with this kind of application you can get the answers within seconds. You don't need to wait for 2 minutes to get the analysis back. Now on top of this, we have created a middle layer, which is a layer with services that are specific for healthcare. So one of the typical services that healthcare or pharma specialists need are ontologies. You have to be able, for instance, to pull in the EHR reports for all these patients. You have to pull in the unstructured and structured data that is related to these patients. You have to pull in all the images, X-ray images, for instance. So this layer here allows you, with the help of these healthcare and life science specific services, to pull in that data and to analyze that data. Now, the other thing that is very important is that you cannot start creating huge clinical data warehouses anymore, because you heard today a couple of times already that the amount of data is simply exploding. So you have to start looking at what we call federation. You really have to start thinking about intelligent ways that the data stays in the different locations, but for instance that you send federated queries to those locations to then collect the answers. And this is also something that helps us to tackle the data privacy issue, of course. Because if you have a federated query that you send over the ocean to ASCO, for instance, to collect there the answer back, you can do that across any country in Europe, and there's no data crossing any border. So you're well within the GDPR regulation. So this kind of federation is really very crucial for the strategy that we are following together with our customers. And on top of this, we built then several types of toolkits. I quickly showed you health engagement that allows you to hook up to the patient. I showed you also very quickly the clinical quality that allows you to look at these quality measures. But we also have tools around cohort analysis, genome analysis, clinical trials in the pipeline that we are working on at the moment. And these toolkits can then easily be extended into applications. And we have here very dedicated applications like, for instance, HealthLink, which is based on this platform here. We have, of course, a lot of activities with partners. So, for instance, our partner Skillline has built an application on top of this platform. And of course, I'm inviting you, if you are creating healthcare solutions, to approach me directly afterwards if you want to. Because we are very interested in building out this ecosystem and to work with you so that you can use this technology and that we start creating more and more momentum with the help of our methodology. Now, with the final slide, I would like to quickly address what our viewpoint is, what our strategy is for the future. I have to apologize, the slide has been slightly corrupted, but I hope I can make it clear anyway. For everything that we do at SAP and with our partners, we always say it is absolutely crucial that the patient is in the center. We have to keep the patient in the center and really think, how can we jointly help the patient? And we are not only talking about the patient outcomes. If we put the patient in the center, we also talk about the patient's concerns around data privacy. So that we also have that always top of mind. And what SAP is focusing on at the moment is building out this network. So we are providing the federative technology that allows us to start connecting the stakeholders that you see on the outside. So the providers, the pharma industry, research and so on. So that they can reap the benefits of the data that they are producing. That doesn't mean that all this data then is moved into a huge pot, right? Into a huge black box where all this data is swirling around. But the idea is really that a very stringent brokerage of the data takes place between these different stakeholders. And what is of course important, and that has been a big hurdle in the past, is that every stakeholder here has a different interest in the patient data. Let's take a look at that. A provider, they will have two interests. That's what I generally hear. They want to make the patient better, and they want to publish, for instance. Right? A pharma company, they want to create nice devices and drugs they can bring to the market. Labs, they want to create, they want to sell reports about values and so on. Now, if you want to create up this network, if you want to create that network, of course everybody has his different interests and everybody has his own needs, his own business model. And that is of course what this platform should definitely enable. And then of course the patient in the center has one very clear interest. The patient wants to stay healthy and wants to get support from all the different stakeholders in this network. So with that I come to the end of this presentation. I would like to thank you.